Western Mass News is your vaccine authority, and many of you have been reaching out wondering if COVID-19 booster shots will be needed in the future and what it will look like.
And we're getting answers from local doctors. Many of you have asked if we'll need COVID-19 booster shots and when.
The short answer is we don't know yet.
Health experts are pretty sure we will eventually need a booster shot, but they're still figuring out specific details.
It's likely that we, as individuals who are vaccinated, will need a booster vaccination for the coronavirus at some point in the fall or winter.
I'd be surprised if we needed boosters every year. It might be every 2 years, every 3 years.
All three companies currently offering COVID vaccines in the U.S., Pfizer, Moderna, and Johnson & Johnson, are developing booster shots. But as millions of people are fully vaccinated, many of our viewers have reached out with questions, and we're getting answers. Mary from Greenfield asked, when will the booster shots be available and how can we get them? Signing up early would be a great idea. I'm high risk and over 65. We asked Dr. Robert Roos, the Chief Medical Officer at Mercy Medical Center, who says there's not a straightforward answer to that question, but he has an idea.
I think it's an expectation, and it's a reasonable one, that with a virus like this that can cause so much illness and death, that we should expect that it could become part of our routine annual vaccination plan, similar to the influenza.
The most common questions we've gotten from viewers like Lloyd have asked, will people have to get the same booster as their initial vaccination, or will changing brands be allowed? Again, Dr. Roos can't say yes or no for sure yet, but he tells Western Mass News it most likely won't matter.
It may not matter what you had this fall or this winter, but you will just get, what is proven to be effective on the strains that are active in the fall or winter.
Health experts are comparing it to the yearly flu vaccine offered, where 3 to 4 brands are offered each year.
Nobody asks what brand they're getting, right? They just all assume it's the same, but in fact, they're made by different companies using the same process.
According to the CDC, for the flu vaccine, no preference is expressed for any influenza vaccine over another. There are many vaccine options to choose from, but the most important thing is for all people 6 months and older to get a flu vaccine every year. Dr. Mark Kerouac, the president and CEO of Bay State Health, says a COVID booster shot will probably follow the same guidelines.
We're going to have 3 or 4 different brands, and no one's going to know the difference.
So there is still a lot of unanswered questions, but one thing doctors believe everyone will agree on surrounding COVID booster shots.
My guess would be, we will be eager to receive whatever type of booster vaccine we need in order to be protected against the variants that are present at that time.